Investigations for acute hematogenous osteomyelitis. As any infection and as any inflammation, sure, blood picture show leukocytosis, high erythrocyte sedimentation rate, and high C-reactive protein. Blood sample and bus sample for culture and sensitivity before intake of any antibiotic therapy. Diagnostic bone aspiration. If we introduce a needle and we bus from and we aspirate from the bone, aspiration show bus. This is diagnostic for inflammation in the bone and osteomyelitis. Plain X-ray. This is plain X-ray very early. Normal. Nothing is seen. About the first 2 weeks, the bone is normal. But after about 10 days to 2 weeks, rarefaction occurs in the area around the osteomyelitis, most probably due to hyperemia. Hyperemia leading to absorption of calcium from the surrounding area and becomes rarefied like this. Later on, after a few weeks, periosteal reaction, periosteal elevation, and the beginning of subperiosteal new bone formation, which is called the involucrum. MRI is better than plain X-ray. It shows manifestations of acute osteomyelitis before appearance in X-ray. Radioactive isotopic scanning may show increased activity in this area. Increased activity in this area may be metastases, may be acute osteomyelitis. Therefore, there is in radioactive isotopic scanning of bone, there is increased activity, but this is not specific for acute osteomyelitis. What is the treatment of this patient? If you suspect osteomyelitis, treatment should be started immediately. Never wait for results of investigation, result of X-ray, result of MRI. No. If you suspect, this is a surgical emergency. If you suspect osteomyelitis, start treatment by immediate hospitalization. And general treatment and local treatment. General treatment, the most important is broad spectrum antibiotic, which should be started very early, as soon as possible, after taking a sample of blood and pus for culture and sensitivity. And the antibiotic should be against the gram-negative and the gram-positive organisms. The best is third generation cephalosporins. And you can change the antibiotic after appearance of the result of blood and pus culture. The antibiotic is given for 2 weeks intravenous and 4 to 6 weeks orally. This is the most important item in the treatment of acute osteomyelitis, antibiotic. Plus, this patient is weak, poor, has poor health, poor immunity. Therefore, we try to improve the general condition in this patient by rest in bed. Bed rest is very important because the bone is now weak. And if the patient walk or run or try to play with his friends, this may lead to pathological fracture. Rest and analgesics to relieve pain, intravenous fluid, or even blood transfusion to improve anemia. Good diet containing high protein and vitamin diet. Locally, splintage of the limb in a slab. Until X-ray show no risk of pathological fracture. If we give antibiotic for 2 days without improvement, this indicates pus formation. And we all know for any pus there is only one line of treatment all over the body. Any pus means drainage. Sure, if there is supraosteal abscess. If there is a supraosteal abscess under general anesthesia, the inflamed bone is exposed. Open the periosteum, evacuate any pus or sequestrum, and a sample is taken from the pus for culture and sensitivity. In severe cases, drill holes can be done in the cortex to decompress the medulla, to decrease intraosseous pressure and drain any pus inside the medulla. Finally, the skin is closed with loose suture to allow drainage of any pus formation. If the acute osteomyelitis show any evidence of chronicity, treat the chronic osteomyelitis as we will mention in the next video. Thank you for good listening and good luck.